Hello everyone, I'm Dr. Pratyusha from Lata Super Specialty Dental Clinic. The main reason why I'm making this video is because nowadays if I see minimum 10 out of every 10 children you will see 7 kids having some dental problem, and daily at least we get 2 kids coming with some pain. And the main reason to blame is sugars, the desserts, the sweets, and especially not gargling in your mouth after every meal. So after my video, there's one small animated video you can show to your kids what is the main reason to get dental caries and how you can protect your kid from getting caries and what are the treatment options available. So if you or your kid is having some dental problem, don't worry. We from Lata Dental Clinic are there to help you out. Watch this video, guys. Bye. Have a nice day.
Specific tiny microbes that live in our mouths. These microbes are with us soon after birth. We typically pick them up as babies from our mother's mouths. And as our teeth erupt, they naturally begin to accumulate communities of bacteria. Depending on what we eat, and specifically how much sugar we consume, certain microbes can overpopulate and cause cavities. Diets high in sugary foods cause an explosion of bacteria called mutans streptococci in our mouths. Like humans, these microorganisms love sugar, using it as a molecular building block and energy source. As they consume it, the bacteria generate byproducts in the form of acids, such as lactic acid. The mutans streptococci are resistant to this acid, but unfortunately, our teeth aren't. While each human tooth is coated in a hardy, protective layer of enamel, it's no match for acid. That degrades the armor over time, leaching away its calcium minerals. Gradually, acid wears down a pathway for bacteria. Acid wears down a pathway for bacteria into the tooth's secondary layer called the dentin. Since blood vessels and nerves in our teeth are enclosed deep within, at this stage, the expanding cavity doesn't hurt. But if the damage extends beyond the dentin, the bacterial invasion progresses, causing excruciating pain as the nerves become exposed. Without treatment, the whole tooth may become infected and require removal, all due to those sugar-loving bacteria. The more sugar our food contains, the more our teeth are put at risk or more susceptible to cavities due to genes that may cause certain weaknesses, like softer enamel. But for most, high sugar consumption is to blame. However, we have developed other ways of minimizing cavities besides reducing our intake of sugar and starch. In most toothpastes and many water supplies, we use tiny amounts of fluoride. That strengthens teeth and encourages the growth of enamel crystals that build up a tooth's defenses against acid. When cavities do develop, we use tooth fillings to fill and close off the infected area, preventing them from getting worse. The best way to avoid a cavity is still cutting down on sugar intake and practicing good oral hygiene to get rid of the bacteria and their food sources. That includes regular toothbrushing, flossing, and avoiding sugary, starchy, and sticky foods that cling to your teeth between meals. Gradually, the population of sugar-loving microbes in your mouth will decline,